and medical technology hold great promise for revolutionary advances in human longevity and well-being across Africa. With proper innovation, African nations could see vast improvements in health outcomes and quality of life for their citizens. However, many African countries still lack access to basic medical technologies and health services due to high costs, infrastructure deficiencies, and shortages of trained medical professionals, preventing widespread adoption of new medical technology solutions. This has led to initiatives like Afrolongevity.
One of the things that we are doing differently is bringing Africa back to their biodiversity. And when you talk about biodiversity, culture is number one. So you see that there are a lot of diseases that weren't prevalent let's say in the last 50 years or so.
What we're focusing on is finding the causes of age, diseases that causes aging. Diseases like cancer, diseases like diabetes, cardiovascular diseases, but not treating them in isolation of each other and saying, let's group them and look at aging as a disease.
Blend them with emerging technologies and also blend them with some African values of respect for elders, intergenerational solidarity, communal lifestyle, communal living, which Africans are known for. Other things like storytelling, music, some aspects of our art and culture that sharpens our cognitive functions and also help us to stay alert both in our bodies and in our minds for longer.
Experts note that African nations need to invest more in research and development to stimulate health innovations originating from within the continent.
So I think we need to be very intentional, refrain from being reactive, and again, a lot of us spoke about policies there. There's no point having a policy without implementation. And I can tell you for free that we do have policies on this, but what is it that we are doing to implement those policies?
With Nigeria's current life expectancy in 2024 projected to be 56.05 years, representing a 0.55% increase from 2023, practitioners emphasize the need for sustainable, evidence-based models.
The same Nigeria where you produce our doctors and pharmacists and nurses, those doctors, nurses are being taken away to, in quote, a better place. It's an irony. But the question is, if you know that you can't stop anybody from, it is important that we also, just like I agree with you, that we must create an enabling environment. Government has realized that, and government is doing a lot in that. It may take time, but the truth of the matter is, do we even have any option? Government must provide not only the enabling environment and also in terms of pay.
These experts believe that through appropriate policies, funding, and international partnerships, Africa's medical technology prospects hold tremendous potential to enhance and save lives across the continent for generations to come. In Lagos for News Central, I am Igbalaniyi, Omoniyi.